I'm Ed Fitzgerald O'Connor. I'm a consultant plastic surgeon based at King's and St Thomas's Hospital in my NHS practice. I specialise in trauma reconstruction, but also have a specialist interest in post-massive weight loss skin removal surgery. It's a question I get asked an awful lot by patients, when they've started their journey on weight loss, either through diet and exercise or through some of the options of bariatric surgery. Patients are often quite keen to sort of think forward and plan for the future when they do have the loose skin. And generally my answer is, that's a decision that you need to make alongside your bariatric surgeon, but it's when your weight is stable. Bariatric surgery is not a weight loss tool on its own. You have to reset your thoughts, feelings, and behaviors around food. Bariatric surgery also helps you with that. And so patients will generally drop a certain amount of weight, depending on the type of bariatric procedure they might have had done. And then once you've got that stable weight for a number of months, minimum 3, ideally 6, that's at the time that we can start considering some of the skin removal options. One of the reasons why you don't want to do it too early is if you remove skin too early and then the patients haven't reached that plateau and you go on to lose further weight, then you're just going to get left with loose skin. And if you haven't plateaued and you potentially go back up again, then it potentially undoes a lot of the work that's done in your recovery post-operatively. This is something that I go through in a consultation with each and every patient, and it's unique to everyone. There's no recipe book or ideal sequence of events or sequence of operations that one can undertake. It really has to be dependent on what bothers the individual. That might be, they want to first address loose skin under their arms because they want to start wearing clothes that in the summer, looser fitting clothes, or it might be around their thighs so they can exercise better, or it might be around their tummy. So really, in weight loss surgery, you get left with loose skin in almost every single area. Commonly, I look at arms, tummies, breasts, and thighs. But again, this is unique to everyone, and it's a decision that you have to make as the patient, and what's important to you. I say to all my patients, weight loss surgery is a journey. And at every stage of that journey, there may well be bumps in the road, hiccups. That might be as simple as a small wound healing area that takes a few extra weeks to heal. Well, that could be quite something serious, such as a blood clot. But in general, if you are of a stable weight and you undertake or choose to undertake an operation that might tighten one area or potentially 2 areas, on average, most patients are fully healed by week 3, back to exercise by about week 6. Compression garments need to be worn for about 6 weeks, and then feeling back to almost normal after about 6 to 8 weeks. Patients who've undergone massive weight loss surgery, who are left with lots of excess skin, it's quite a niche area of plastic surgery. Yes, it's just skin removal, but there are a number of nuances that one has to consider with regards to this type of operation. Normally, patients are at slightly higher risk of complications, so that's wound healing or even, rarely blood clots. And so there's a number of interventions that one can consider either during the operation or after the operation, just to minimize as best as possible some of those risks and complications, such as doing the operation under spinal anesthesia, utilizing a number of assistants to help speed up the process so there's at least time on the operating table as possible. So I think post-massive weight loss skin removal surgery is very niche. I believe that patients should do their homework and look into how much experience each surgeon has in that specific area, because you really want to minimize all of the potential risks and complications as possible. I guess in general, patients who've lost huge amounts of weight, it's almost like a rebirth for them. And the removal of the skin to tighten everything up is like the icing on the cake. And so on a whole, all of my patients who have been through that journey, albeit if they've had hiccups or albeit they've sailed through, it is life-changing for them.